Have you ever taken a sip of ice-cold water on a hot day, only to be met with a sudden, sharp jolt of pain in your tooth? It's a feeling that can really stop you in your tracks, turning a moment of refreshment into one of instant regret. This shocking sensation is what we call tooth sensitivity. It can also happen with hot drinks, sweet treats, or even a gust of cold air. Many people experience this and immediately worry that their teeth are weak or failing. They might feel embarrassed or anxious, thinking it's a sign of poor dental hygiene. But I want to reassure you right away. Having sensitive teeth does not mean you have weak teeth. It's not a character flaw or a sign of personal failure. Think of it less as a problem and more as a message. That sharp, unpleasant sting is actually a vital warning signal. Your tooth is trying to communicate with you. It's like a tiny built-in alarm system that goes off when something isn't quite right. Instead of seeing it as a weakness, we should learn to see it as a call for help. Your body is incredibly clever, and this pain is its way of telling you that a specific part of your tooth has lost its protective shield and needs some attention. Ignoring this signal would be like ignoring a fire alarm just because the noise is annoying. The pain is a messenger, and it's delivering a very important piece of information directly from the front line of your oral health. Listening to it is the first step towards solving the issue. The crucial thing to understand is that tooth sensitivity is not a disease in itself. Rather, it is a symptom, a sign that the outer defenses of your tooth have been compromised. Our teeth are designed to be incredibly strong and resilient, protected by a hard outer layer. When this layer gets worn down or damaged, the more sensitive inner part of the tooth becomes exposed. This exposure is what leads to that sharp, sudden pain when it comes into contact with certain triggers. It's a direct line of communication from the nerve deep inside your tooth, letting you know that its protective barrier has been breached and it is now vulnerable to the outside world. So, the next time you feel that familiar twinge, try to reframe your thinking. Don't blame yourself or feel discouraged. Instead, take a moment to appreciate what your body is telling you. This is your chance to take action before a small issue becomes a much bigger one. It's an early warning, giving you the opportunity to investigate the cause and make simple changes that can protect your smile for years to come. By understanding that sensitivity is a signal, not a failure, you can approach the problem with confidence and take positive steps toward finding relief and ensuring your long-term dental health remains in excellent shape. To understand why a tooth becomes sensitive, we need to take a quick look at its basic structure. It's much simpler than you might think. Imagine your tooth is made of 3 main layers, one stacked on top of the other, each with a specific job to do. The outermost layer, the part you see when you smile, is called enamel. Enamel is the hardest substance in your entire body, even harder than bone. Its main purpose is to act as a super tough, protective shield for the delicate inner parts of the tooth. It takes the brunt of all the chewing, biting, and grinding you do every single day, keeping the more vulnerable layers safe from harm. Beneath the strong enamel shield lies the second layer, which is called dentin. Dentin is a softer, more porous material that makes up the bulk of the tooth. It's not as tough as enamel, and it has a more yellowish color. What's really important about dentin is that it's filled with thousands of microscopic hollow tubes, almost like tiny straws. These little channels, known as tubules, run from the outer surface of the dentin directly to the very center of the tooth. They are essentially tiny passageways that lead straight to the tooth's nerve center, connecting the outside world to the sensitive core within. At the very heart of the tooth, protected by both the enamel and the dentin, is the pulp. This is the soft living tissue that contains the tooth's nerves and blood vessels. The pulp is the command center. It's what keeps the tooth alive and allows you to feel sensations like heat, cold, and pressure. When everything is healthy, the pulp is safely tucked away, completely shielded from the outside environment by the layers of dentin and enamel. This protective structure ensures that everyday activities, like eating an ice cream or drinking a hot cup of tea, don't cause any pain or discomfort to the delicate nerve endings. The problem of sensitivity arises when the protective enamel layer wears away, or the gums recede, leaving the softer dentin layer exposed. Once the dentin is uncovered, those thousands of tiny tubules become open gateways. When you drink something cold or eat something sweet, the sensation travels instantly through these open channels, directly stimulating the nerve in the pole. This is what causes that sharp, sudden, and shocking pain. It's not a problem with the nerve itself, but rather the fact that the nerve's protective barrier has been breached, leaving it completely defenseless against external triggers. When it comes to tooth sensitivity, there are many common myths that can lead to confusion and prevent people from getting the right help. One of the biggest misconceptions is that if a tooth is sensitive, it must have a cavity. While it's true that a cavity, which is a hole in the tooth, can cause sensitivity, it is far from the only cause. As we've learned, sensitivity often happens simply because the enamel has worn thin or the gums have receded, exposing the dentin. You can have perfectly cavity-free teeth and still experience significant pain from sensitivity. Assuming it's a cavity might cause unnecessary worry, so it's always best to get a professional diagnosis. Another widespread and damaging myth is that brushing your teeth harder makes them cleaner. Many people believe that applying more force with their toothbrush will scrub away stains and plaque more effectively. In reality, the opposite is true. Brushing too aggressively, especially with a hard bristled toothbrush, acts like sandpaper on your teeth. Over time, this vigorous scrubbing can wear away your protective enamel and also damage your gums, causing them to recede. This action directly leads to the exposure of dentin and is one of the most common self-inflicted causes of tooth sensitivity. Gentle, thorough brushing is always the better and safer approach for a truly clean mouth. When pain strikes, it's natural to reach for a painkiller to get quick relief. However, another myth is that painkillers can fix the problem of tooth sensitivity. While a paracetamol or ibuprofen might temporarily dull the ache, it does absolutely nothing to address the underlying cause. The pain is a signal that your dentin is exposed, and masking that signal doesn't repair the damage. The moment the painkiller wears off, the sensitivity will return just as sharply as before. Relying on them is a short-term patch that allows the root cause of the problem to persist and potentially worsen over time, leading to more significant dental issues down the road. Finally, many people try sensitivity toothpaste, but give up quickly, claiming it doesn't work. This is because of a misunderstanding about how these products function. Sensitivity toothpaste isn't like a painkiller that provides instant relief. Instead, it works by gradually building up a protective layer over the exposed dentin tubules, or by soothing the nerve itself. This process takes time. To be effective, you must use the toothpaste consistently, twice a day, every day. It can often take several days or even a couple of weeks of regular use before you notice a significant reduction in pain. The key is patience and consistent application for long-lasting results. While common causes like aggressive brushing are well known, there are several surprising daily habits that can secretly contribute to tooth sensitivity. One of the most common is night grinding, also known as bruxism. Many people clench or grind their teeth in their sleep without even realizing it. This habit puts immense pressure on your teeth, far more than normal chewing. Over months and years, this constant grinding can wear down the enamel, especially on the chewing surfaces, leaving the sensitive dentin exposed. If you wake up with a sore jaw, a dull headache, or tired facial muscles, it could be a sign that you are grinding at night and inadvertently damaging your teeth. Your diet can also play a sneaky role, particularly the consumption of acidic foods and drinks. A habit that has become very popular for its supposed health benefits is drinking lemon water first thing in the morning. While lemons contain vitamin C, they are also extremely acidic. Sipping on acidic drinks throughout the day constantly bathes your teeth in acid, which can soften and erode your enamel. The same goes for fizzy drinks, including diet versions, sports drinks, and even some fruit juices. This acid attack weakens the tooth's outer shield, paving the way for sensitivity to develop over time, even with a good brushing routine. The timing of your brushing routine is another hidden factor. Many of us brush our teeth immediately after a meal. However, if you've just consumed something acidic, like orange juice or a salad with vinaigrette dressing, your enamel will be temporarily softened by the acid. Brushing your teeth during this softened state can actually scrub away the weakened enamel particles, accelerating erosion. It is much better to wait at least 30 to 60 minutes after an acidic meal before brushing. This gives your saliva enough time to naturally neutralize the acids in your mouth and allow the enamel to reharden, making it safe to brush. Finally, two less obvious culprits are mouth breathing and a potential vitamin D deficiency. When you breathe through your mouth instead of your nose, especially at night, it dries out your mouth. Saliva is your mouth's natural defense system. It washes away plaque and neutralizes acid. A dry mouth is a more acidic environment where enamel erosion can happen more easily. Furthermore, vitamin D is essential for the absorption of calcium, which is a critical building block for strong teeth and bones. A deficiency in this vital nutrient can compromise the integrity of your dentin, potentially making your teeth more susceptible to problems that lead to sensitivity. The most important message to take away is that early treatment is key. If you ignore that initial painful twinge, the underlying problem will not go away on its own. Continued enamel erosion or gum recession can lead to more severe and constant pain. What starts as a minor sensitivity can eventually progress into a much bigger dental issue, potentially requiring more complex and expensive treatments like fillings, crowns, or even root canal therapy. By taking action as soon as you notice the sensitivity, you are not just managing pain. You are actively preventing more serious damage to your teeth and preserving your long-term oral health. Fortunately, there are several practical and simple steps you can take to manage and prevent tooth sensitivity. First, switch to a soft bristled toothbrush. This is a non-negotiable change. A soft brush is just as effective at cleaning your teeth as a medium or hard one, but is infinitely gentler on your enamel and gums. Second, master the art of gentle brushing. Use small, circular motions and apply only light pressure. Think of it as massaging your teeth and gums, not scrubbing them. This technique will effectively remove plaque without causing any abrasive damage to your precious tooth structure. The next step is to incorporate a desensitizing toothpaste into your daily routine. Use it twice a day, every day, without skipping. Remember, consistency is crucial for these toothpastes to work their magic. They need time to build up a protective barrier over the exposed dentin tubules. In addition to this, be mindful of your diet. Try to limit your intake of acidic foods and drinks. When you do have them, drink them quickly, rather than sipping over a long period, and consider using a straw to minimize contact with your teeth. Crucially, always remember to wait at least 30 minutes before brushing. If you follow these tips and your pain persists for more than a week or becomes severe, it is essential to see your dentist. They can properly diagnose the cause of your sensitivity and recommend a professional treatment if needed, such as applying a fluoride varnish or a bonding agent to seal the exposed dentin. Ultimately, tooth sensitivity is that early warning we talked about, not a sign of weakness. It's your body's way of asking for a little help. By listening to that signal and taking these simple, proactive steps, you can treat the issue early, protect your teeth from future damage, and save your smile for years to come.